Hey, Mob. Yeah, just going to give a little info session on smoking in pregnancy, and then also a little overview of the TIS program, Tackling Indigenous Smoking program, and what we sort of do. First off, I'd just like to acknowledge the traditional custodians of the land, the Whadjuk people of the Noongar Nation, and their continuing connection to the land, waters and community, and pay respects to Aboriginal and Torres Strait Islander communities and cultures, and to the elders past, present, emerging, as well as all the Indigenous people who are on today and the country you're on. Pay respects to you guys. So yeah, the Tackling Indigenous Smoking program at APGA, it expands on community engagement and ongoing contribution, and support throughout the Perth metro area, and then we support the outer Western Australian regions to increase awareness on health impacts of smoking to the Aboriginal and Torres Strait Islander community. And there's our contact details for anyone who would like them. If you don't get them now and you want them later, just let us know. But yeah. So yeah, TIS teams in Western Australia, 8
Guys,
TIS
I
teams.
don't think your PowerPoint's synced to the one that we're watching. I don't know if anyone else having issues.
Press sync to presenter. Can you press that? Hit the mouse.
Oh, sorry. Yeah.
Apologies, everyone. Yeah.
Yeah, flick.
Or just maybe press the arrows. Can you see the next slide?
No, we're still just on the first slide.
Is it not syncing? Sync to presenter. Did someone take control of our thing? I saw someone take control of it earlier on. Has someone taken control of our thing?
That was me
Can you
moving
press
it.
take
Does
control?
it work if I move it? Yes.
Okay, now it's working on us. Cool.
Okay.
Can you see it? Third slide? Yeah, cool.
Yeah, all good now.
All right, we've got control.
Yay!
Yeah. So yeah, there are 8 TIS teams in WA, and here is where they're located. So yeah, in throughout the Aboriginal Medical Services in WA, and then there's 40 TIS grant recipients across Australia that are funded by the Commonwealth. So that's a little map of pretty much where all of them are. There's a new updated map coming out soon, I think, which will show a couple of different areas because it's changing a little bit. So a quick background on smoking history in Australia. So the pituri plant here in the pictures is found across the central desert of Australia, all the way from Queensland right through Northern Territory to South Australia into WA. And our mob used to, or they still use it today, as like a chewing tobacco. They dry the plant out, ground it, and crush it up, and that would be their form of natural chewing tobacco. It's still used out in community now. So that was the form of tobacco that our people had from the early days, before white settlement and Captain Cook arrived. And before that also, our mob used to trade with the Macassan people, so the mob from up Indonesian way. They would come down into Northern Territory area, up north, the north of Australia, and want to trade with our mob to be able to go fishing in Australian waters. They would find like a sea cucumber, which they use for medicine. So they would trade with our mob for our mob to give them permission to fish and look for this sea cucumber, and they would trade with our mob like their forms of tobacco and pipes and all different kinds of stuff, which slowly introduced smoking in our community.
Right.
And then obviously when Europeans first entered Australia, they would get our mob working, and their payment, they would get cigarettes for payment. So that sort of started like a generation trauma kind of thing. Like from then, they started they'd be paid with cigarettes. So then the next generation just sort of saw it as a what it's a normal thing, what everyone did. So that's why that's something that contributed to smoking rates being so high within our mob. Okay, here's a quick little look at some things that are in a cigarette. There's 7,000 chemicals. So there's more than 7,000 chemicals in a cigarette, and here are just a few. It's going to come up. Here are a few of the bigger ones. It's not working. I don't know why it's not coming up. Oh, there you go.
Transitions.
There you go.
All right, so here's a few of the big ones. Lead from batteries, tar used for the roads, arsenic, which is in rat poison. There's nail polish remover, toilet cleaner. Nicotine, obviously, is the big one, most addictive chemical in it. And all right. So this is what smoking causes. There's a photo of a very healthy lung on the left, and on the right, obviously a very damaged lung from tobacco smoking
and heart.
The heart's
So smoking causes 16 types of cancers, direct cancers, and here they are. So I won't go through them all, but some of the big ones, obviously.
I did not even realise that it causes Crohn's disease. That's quite interesting, actually. Wow, there you go.
So it has links to all these cancers and diseases. So big ones, obviously mouth, throat, and lung cancer. They're probably the big main ones, but it has links to all these 16 different types.
I didn't know it was linked to ectopic pregnancy.
Yeah, it's I don't know.
It's from the cilia movement.
Oh, yeah, right. So the movement of the egg along the fallopian tube.
Yeah.
And then if the cilia are not, which are the little sort of wavy things that push the egg across, if they're not working properly, the egg would get stuck. Sorry, Sam.
That's all right.
Yeah.
Fascinating.
Yeah. So effects on smoking before and after pregnancy. So it causes low birth weight in babies, and the babies at a greater risk of dying, and that they're more vulnerable to infection. And it gives them breathing difficulties and obviously long-term health problems when they grow up. Smoking during pregnancy increases the risk of problems including miscarriage, premature labour, and you're twice as likely to give birth to a low birth weight baby compared to a mother who doesn't smoke. If you're pregnant, every time you smoke a cigarette, it cuts down oxygen to your unborn baby and exposes them to the 7,000 chemicals that are in the cigarette. So it's actually not 7,000 in the cigarette, but once it's lit, that's all the chemicals react, and then it makes it up to 7,000. And it's a long-term damage to the lungs, brain, and blood of any unborn child, and can cause pregnancy emergencies for the mum. So risk of smoking during pregnancy. So here's some of the risks that can happen to the child, unborn child, or when they're born. You get cleft lip and cleft palate there. Low birth weight, as we said before. Cerebral palsy. A lot of different.
Yeah, what's interesting about the cleft lip and cleft palate is it's not something that you can do since birth. It's a pretty intense surgery, and it requires sometimes there's multiple stages involved, and you have to be a certain age. So that's a really intense condition to have.
Very, and it can be in severity, so you can get, you know, minor and more major cleft palate. But that opening up inside the mouth there, that's actually opening up straight through to where the brain is, like it's right through, yeah.
Yeah, to the sinuses and
Yeah,
the to the
yeah.
brain. Yeah, excellent.
So here's some key stats here. So less than half Aboriginal and Torres Strait Islander women smoke, which is 43%, which has come down from the last study in 2009, which was sat at 50%. So it's decreasing, which is good. So which way? That's what they're called. Which way? They surveyed 428 Aboriginal and Torres Strait Islander women of the reproductive age, and here are some of the results they got from that. So it included 63% of women who smoked, as well as 37 who didn't. Some of the key stats they found from that: 90% of women who smoked tried to quit at some point during the pregnancy. 66% reported trying to cut down smoking in the past month. Only 36% of women had ever tried medications, like the nicotine replacement therapy, to help them with quitting. Medications were more, so the NRT was more likely to work for women who are over 35 years of age, and obviously living in bigger city areas, not as likely in remote, probably because due to being a bit harder to get the nicotine replacement therapies out there.
Yeah.
Quitting suddenly rather than gradually was more effective. So like the cold turkey, probably.
Interesting. Okay. Very interesting, because that's usually not the case when it comes to kind of like behaviors which that have an addictive component to it. So yeah, okay, that's really cool.
Yeah, quite often people try to quit multiple times and they can't. So they try the different things, and then the most common way a lot of people say is
just go on cold turkey.
But that was the thing that brought it. Okay.
Yeah, but obviously they've tried enough times in the past.
Yeah.
Try, and then eventually it just.
Yeah.
So.
Yeah.
And also the best. A lot of them in the survey. A lot of them said that having an Aboriginal health practitioner was, was of greatest help to having them quit.
Quit, really.
Yeah.
That's good. Yeah. Yeah.
So passive smoking, just touch on that. Secondhand smoke. In Australia, secondhand smoke kills 1,500 people each year who aren't smokers, which is pretty damning. And then here's some of the causes it has for children. So child cancers, asthma, lung and respiratory infections, ear problems, and sudden infant death syndrome. Obviously, we touched on the adults and lung cancers and things like that. And then for pregnant women, some of these have been covered already as well. But premature birth, low birth weight. So they're some of the big causes that secondhand smoke has effects on everyone. So it's not just you smoking or the person smoking himself. They're just being around cigarette smoke. Benefits of quitting smoking before or during pregnancy. So stopping smoking completely as early as possible during pregnancy is the best for your health and the health of your baby. By quitting smoking or not being around others that smoke during your pregnancy, your baby is less likely to die from SIDS or cot death, less likely to suffer middle ear infections or have permanent hearing impairment.
Yeah. It's not.
More likely to be settled and feed better.
Yeah.
Premature birth is less likely, and less damage to the baby's heart and lungs. So sooner as quit, the better.
And when by low birth weight, they're talking about like babies less than 2.5 kilos. So So little babies are often, find it hard to feed. They may have, difficulty breathing, and it's just it's often a difficult start to life. Yeah.
So thinking about quitting for yourself and your baby, there's always a good time to stop smoking before, during, or after the baby is born. Obviously, earlier is the better. And other tips to do is make your home and car smoke-free zones. So keeping cigarette smoke away from them areas where baby's going to be a lot. Traveling in the car and at home.
Yeah.
And then encouraging other people not to smoke around you.
Interesting that comment. I can imagine that encouraging smokers not to smoke around you. That's a hard thing to do, because that involves challenging someone else. And I can imagine also, now that we're having more and more e-cigarettes as well, that's something that people need to put into the conversation, that you're encouraging smokers, including people who smoke e-cigarettes, not just smoke around you when you have an infant. So yeah, no, that requires a lot of courage to bring that up, right?
Yeah. Or even, I've had people say, I prefer you not to hold the baby if you've had, because the cigarette smoke being on your clothing. And I know, I've had family that have been very upset by that, but, if
so it's your baby, like you're allowed to ask things, right?
Yeah.
So, yeah. Fair enough.
Can I just say something up here?
Sure.
It's Jenny Rogers in Kununurra. We've got our FASD program, so we do quite a bit of alcohol in pregnancy, but also tobacco use. We've got a TIS program as well. But one thing we also promote and try and give out is a spare shirt.
Nice.
So not to smoke or hold baby in a shirt that you've been smoking in.
Wow.
So encourage different clothing, or to have a towel or a rug or something to throw over yourself when you are smoking. You take that off, and then when you're holding baby or whatever, you're not secondhand smoke and rubbing it onto bub and all that sort of stuff. Also encourage a whole lot of hand washing. Just to remove that secondhand smoke from yourself. And we also try and give out with our mums a t-shirt that's just a designated smoking sort of shirt, if it's harm reduction about once they are pregnant or have the baby, they've turned into a host. So harm reduction to the main patient or the main client, which would be the baby. So it's a good thing if you do have any money within programs to get sort of stuff like that also promote enabling those sort of activities. So a spare shirt or something with your program branding.
On the towel.
On the towels or whatever that they can use also. And then also giving out a lot of soap, hand wash, that sort of stuff, because it actually promotes or helps the mums to be able to do that.
Oh, thanks, Jenny. That's great. Yeah.
Jenny, I'm writing this down. Thank you for that. That was a great idea. I might contact you more to get some more information about that, if that's okay with you, because I'd love to spotlight you in a newsletter or something.
We've actually got a high level. I wish we was at the 50% when it comes to smoking, but nothing. So we've got to think of ways to not only, it's one thing to have those ideas, but you need to actually start the ball rolling, should we say. So provide them with stuff to actually advocate for their baby.
Oh, and I love that, because in a way you're supporting both, because we know how difficult it is to give up smoking for some people. But to be able to go, well, I don't, I really want to look after my baby. Well, here are some things you can do. I think that's really
That's nice, because
here's some ideas. But they also remember us mob, we're still very social, black fellas.
Yeah.
So we don't want to be left out of the party.
Yeah.
We still want baby to be welcomed and whatnot. So this is, instead of it being confrontational, don't smoke around me, go away. It's hey, if you're not gonna smoke, can we try this and this first? Or even before you enter the house, I can smell like smoke. Go wash your hands, rinse your mouth.
That's nice, and it's guilt-free. It's trying to remove the guilt that comes with smoking, because people don't want to quit if they're like, there's all this guilt around them. Like, we reduce it as much as possible.
Yeah, because we want to go from the harm reduction point of view, and we don't want mum and bub to be ostracised.
No.
Yeah.
You could be dealing with postnatal depression as well. It's already hard enough having a baby, but you're so tired. So I think that's great. Yeah.
Thank you, Jenny.
Thanks,
That's
Jenny.
great.
Oh, you done, are you, Sam?
No, still a couple of them.
Okay, cool.
This is how we talk. We just this is our interrupt presentation. Sorry.
Yeah, here's some of our promotional resources. So we've got the Bubble on the Way book there, which is for mum and to help her when she's going through pregnancy period and baby's born. And then there's also Deadly Dad's tips there to help dad out, because it's we've talked about it a lot recently with the tips programs that male person plays a big role as well,
Huge
as
role.
helping supporting mum
Yeah.
when baby's born, and if both partners are smoking or one of them smoking, they can help each other to get the best outcome for the baby to live a healthy life.
Yeah.
And then here's some. Just remember, once you start smoking, it's hard to stop because tobacco contains nicotine. But as soon as you stop, the better. Your body will start to heal itself and start to mend. Much easier not to start at all, obviously. And then there's just a couple of questions why people start smoking and what are some important reasons for you not smoking. But we don't have to run out a bit of time, so skip through that.
I mean, why do people start smoking?
There's so many different
reasons.
reasons. It really is just dependent on a person's individual circumstances, right?
Yeah.
And no matter how many times you rise the price of cigarettes, it's not going to completely stop people from smoking. That's not the answer. It's really just that you have to, I guess, as a clinician, you have to work through with the person, like what's going to motivate you to stop. And usually there's a motivator for people to stop smoking and actually take that final step. So otherwise there's just, and there's always going to be relapses as well. Like I don't think you'll ever meet someone who's just quit and that's like the end. Like there's almost always there's going to be relapse moments, and that's okay. I think that's also important to encourage people that you're not a failure for relapsing.
Yeah.
After you've attempted quitting smoking, so there's that too.
And then here's some places to help quit smoking. Obviously, quit line, your doctor, local AMS, tackling Indigenous smoking team. We've got 8 around the state, so should be enough support there. Chemists, nurses, family and friends, and other people who have quit. Always a good
go-to.
Yeah, for support.
I had no idea that quit line was 24/7. There you go. That's really cool. Yeah, I thought it would be like just 9 to 5, like 8 to 6 or something like that. But the fact that it's 24/7, that's great. Yeah, it's awesome.
Well, sometimes you want to do it in the middle of the night. That's
yeah, exactly. Yeah, when the crackers hit. Yeah.
Anyways, thank you, everyone. If there's any questions, you can let me know. But yeah, thank you.
Yeah.
Any questions?
Yeah, I think we've got a hand up from, is it Geraldton? Oh, you're waving. Is there any questions from anyone out there?
Oh, lots of claps. Wow.
Lots of claps. Oh.
That's nice. There's so many. Oh my God, that just keeps going.
Yeah.
All I'm just excited to see is more research into the e-cigarette space. That's all I want to know, because I feel like it's still quite new, and I think the evidence on the toxicity around e-cigarettes and maybe the nicotine amounts, like the research is still building on that, and I'm really excited to see where that's going, because I have a friend who works in Northern as part of almost like the TIS team there, but with wax. And they're talking about e-cigarettes having like up to 38 times the amount of nicotine as one compared to one cigarette, because it's so unregulated, even though they're supposed to be nicotine free. And these are ones in WA, because there was a study done in Curtin looking at e-cigarettes all across WA. So it'll be interesting to see the evidence build there.
Yeah.
I got a bit of a question about that, actually. I was going to ask Sam if you guys have done any looking into the e-cigarette space and like the vaping stuff. Is there like studies around that show harms of vaping with or without nicotine content? So the nicotine-free vapes as well?
I'm not aware of if there's a study being done about nicotine or without nicotine. I know there's been studies looked into what vaping does, but yeah, it's still very new, so it's still, it's coming out, changing all the time. But yeah, I haven't come across anything with nicotine or without it yet.
If you go on the Lung Foundation website, there's a vaping e-cigarette portal there, and they have a link to that curtain study that I just mentioned. Not too much else. There is like a toolkit for people, but it's I wouldn't say there's much on there. So yeah, there's just some information about that curtain study there. So yeah, check that out if you have the time.
Easy, thanks.
Any other questions?
Also, just a comment, that quit line, it's now, there's an Indigenous quit line, and they're Aboriginal people that you talk to when they're who answer the phone, that are your counsellors. And you can also get a call back as well. So if you got no credit, that's not an issue.
That's great.
Oh, I love that idea. That's great. I love a good callback. Fantastic. Excellent.
All right. Well, 12:31. Thanks very much for joining the Birds and BBB Bites. Thank you to Sam Stubbs for joining us today. That was a great presentation, Sam. I actually learned quite a bit myself. It was really good. So yeah, I'll send you out another reminder, but next Tuesday we've got a doctor from MCDC, King Edward Memorial Hospital, talking about syphilis in pregnancy. So if you can join us next week, that'd be great. Otherwise, it will be recorded and available on our AQUA website and YouTube channel. So thanks again, everyone. Enjoy the rest of your week. It's great to see Mob from out in the regions. It really is. Masks on and all. You look great out there. Thanks for joining us. Okay.
Keep safe out there.
Bye.